Suicide Prevention and Mental Health, organized by the Committee of Justice of the Parliament of St. Martin. I'm honored to welcome our esteemed panelists, Dr. Tamika Lambert of the Mental Health Foundation, Dr. Tashina Thomas McCoof of Turning Point. We also invited a representative of the Alliance of Psychologists and Allied Professionals of St. Martin. However, they were unable to attend. We currently have established a quorum of 4 fractions and 9 members. Please stand for a moment of silence. Thank you. I have not received any, I've received notice of lateness from MP Peterson, MP De Wever. Are there any notifications from the members of Parliament? That does not seem to be the case. I will now go over to the agenda point. As you can hear, I'm a little under the weather, so please bear with me. The agenda point meeting for this committee meeting is roundtable panel discussion on suicide prevention and mental health. We now go over to the agenda point. On October 28, 2024, Parliament received a letter of my person, MP Shamira Rosenberg, registered under IS number 216-2024-2025, with a request for a meeting to discuss a proposal for a roundtable panel discussion addressing the rising crime, suicides, and increasing violence within the schools. The reason for this request was to address the urgent and concerning issues currently affecting our society, as it relates to the previous mentioned topics. This meeting was held on November 19, 2024, during which the committee deliberated and decided to host the roundtable panel discussion with the purpose to formulate a position as a committee and Parliament, enabling further deliberation with the government and requesting and recommending actionable steps based on the information received from the participating stakeholders. The committee has decided to organize the roundtable panel discussions in 3 sessions. Session 1, being this session, is an open door session, roundtable panel discussion, as I mentioned, on the top 2 topics, mental health and suicide prevention. Session number 2, which will take place at 1 p.m., will be a roundtable panel discussion on the rising crime and increase in violence within the schools. The following experts will be present during that panel discussion: the Dean of St. Martin, Mrs. Elena Berry, the Director of Scars to Stars, Ms. Anne Marlin, Project Manager of the Youth Brigade, Mr. Michiel Peterson, Executive Director of Stichting EGO, Mr. Alejandro Francisco, Youth Development Practitioner, Mr. Jacques Heemkerk, and representative of the K1 Britannia. SAES was also invited for the open door session, but has informed us that it will participate in the closed door session, which will take place tomorrow, Friday. Session number 3 will be this coming Friday, March 28 at 10 a.m., and this will be a closed door roundtable panel discussion on the rise and increase of violence in school. Present will be the Minister of Justice, Ms. Natalie Tacklin, Minister of Education, Culture, Youth and Sport, Ms. Melissa Gomes, Chief of the Police, Mr. Carl John, Head of Juvenile Department, Mrs. Dean John Muller, Representative of the Public Prosecutor Office, Mr. Soleil, Head Student Support Division, Ministry of Education, Culture, Youth and Sport, Mrs. Olga Service Mossington, Department Head of the Court of Guardianship, Ms. Kimberly Brown, Section Head Youth Probation, it will be Mr. Marciano Geëerd, but our other representative, as I understood that he's off island, and the Head of Stichting Justitiële Inrichtingen, SJIS, Mrs. Cynthia Filemon, our other representative, as she's off island as well. I now continue with the agenda point of today. Over the past year, St. Martin has faced a surge in both suicide and mental health challenges through the island. We can see this if we just look around while walking or driving in our vehicles. This alarming trend highlights an urgent call for awareness support, and intervention to safeguard the well-being of our people. So here are a few questions. Is the feeling that many have as it regards to the numbers surrounding mental health cases accurate? What can Parliament do from its role? What can the government do from its role? What can the society and community do? What are the mental health aspects related to crime, suicide, and school violence? What connections are there between substance abuse, crime, and behavior issues? And how can we deal with those? It is important to reiterate that the main objective of this expert panel discussion is to allow the members of Parliament and the general public to ascertain and receive information and advice on the issue of mental health and suicide prevention on St. Martin, in order to propose solutions to government and Parliament on ways to tackle the issue on the island. A list of local professionals in these fields were submitted by my person as well as other members of Parliament, and thereafter an overview document drafted by the Secretariat was sent to the committee via the email procedure for review and approval. I would like to thank the members of the committee for their input to the proposal and also to the distinguished panel of professionals who accepted our invite, prepared the documentation and our papers, and for being here today. And so we now move over to today's meeting format. Our experts will have 5 to 10 minutes to present themselves, their thoughts, findings, and recommendations as it relates to mental health and suicide prevention on St. Martin. After all panelists have presented, the floor will be open to the members of Parliament, during which each member will be given the opportunity to pose their questions or comments, to have a more dynamic exchange between the members and the panelists. Thereafter, we will adjourn the meeting briefly. After the adjournment, questions and/or comments submitted by the public will be tabled and answered by the panelists. The public in the tribune will also be given the opportunity to pose questions or share their comments. As a parliamentary committee, it is important to engage different segments of the community in all that we do, because in the end, our decisions will have an effect on us as a community and as a people. Hence, as previously indicated, members of the public could have, and we encourage those that are currently now viewing and listening to submit their questions via the available link and form that can be found on our social media channels. This form can be filled out until 11:15. It is important to note that the questions and comments received from the public will be reviewed by the Secretariat of Parliament and thereafter assigned based on alphabetical orders to the members of the committee to be posed to the panelists. These assignments will take place digitally during the adjournment. So I ask the members to pay attention to their Teams chat. In addition to the aforementioned, to further promote community involvement, several youth organizations were involved to submit short videos sharing their respective perspectives on the topic. These videos will be played during the discussions, whereby we are assuring that young St. Martin voices are an integral part of the conversation. I now go over to our first presenter, which is Dr. Tamika Lambert from the Mental Health Foundation. Dr. Lambert, I now give you the floor.
Good morning, all. Good morning, MPs, and good morning to our esteemed guests. We are here today to talk about something that touches us all, whether we realize it or not. We will talk about suicide and mental health struggles, as they are not just statistics, they are real people. Mental health, however, is not just a personal issue, it is a society one. It affects our community, and it's important to know that on average, 46% of persons will get a major psychiatric disorder during their lives. For far too long, this has been surrounded by stigma. Thankfully, VSA, the World Bank, NRPB, and Trimbus are helping us to improve mental health on our island. However, at current, the budget for mental health per person is still labeled lower compared to our neighboring islands. We cannot afford to keep ignoring the crisis that is unfolding before us. So today, we come together to face it head on and follow up on solutions. Now, let's talk a little bit about the reality of suicide and mental health on St. Martin. Suicide is the tragic endpoint of deep personal struggles, overwhelming circumstances, or mental illnesses. It is not just about sadness. It's about despair, hopelessness, and a feeling of isolation, and the constant rumination of not getting a major problem off one's mind. The reality is that many will die by suicide, many that have died by suicide have never received the mental care that they needed. Some were too afraid to seek help, others did not know where to turn, and some faced obstacles that made accessing care impossible. In St. Martin, the hidden demand for mental health care is significant, and we are only seeing the tip of the iceberg. Only a fraction of those struggling with mental health conditions seek professional help. The reasons vary, but by stigma, self-judgment, lack of awareness, misconceptions, financial barriers, and insufficient mental health infrastructure all play a role. First things first, society must first solve poverty, because poverty is one of the major contributing factors to mental health issues. If persons' basic needs aren't met, it will impact their mental health severely. We must now understand that mental health and society both offer a shared responsibility. Mental health is just not a concern by those affected, but it impacts everyone. When individuals struggle with untreated mental illnesses, it affects their families, their workplaces, and society. For example, productivity declines, relationship suffers, and the healthcare system becomes a burden with the crises that could have been prevented with early intervention. According to PAHO's statement, there is no health without mental health. This implies that mental well-being should be a priority, and this requires a collective effort from government leaders, healthcare professionals, community organizations, businesses, and all that are involved, including ourselves. Now, let's talk a little bit about what are the challenges here that we encounter here on St. Martin. Despite the progress in raising awareness, several challenges continue to hinder the effective mental health care on our island, St. Martin. First of all, we struggle with limited mental health resources. For example, at the Mental Health Foundation, there are far too little mental health professionals to help with the growing demand. For example, the number of psychiatrists, psychologists, and psychiatric beds available to offer the services and the demand that we have. Then we have persistent stigma and cultural barriers. Many still believe that seeking help is a sign of weakness. This stigma prevents individuals from reaching out for support. Then we have financial and structural barriers. Many individuals simply cannot afford mental health care, and insurance oftentimes do not offer adequate treatment in private practices. Additionally, the lack of inpatient facilities limits options for those in crises. Then we have substance abuse and addiction. The high social acceptance of alcohol and drug use contributes to many mental health issues. Yet, addiction is still not legally recognized as a disease making it harder to provide adequate care. And finally, lack of early intervention, education, and empowerment. Schools and workplaces cannot provide enough mental health education, leaving individuals unprepared to recognize symptoms and seek help early. Now we may ask, what is St. Martin mental health system doing? Now, we here at the Mental Health Foundation have been actively working to combat these challenges. For example, we have been working on increasing awareness, reducing our waiting time by hiring more clinicians, and have modernized the treatment with advanced psychotherapies and medications that produce less side effects. There is also a growing focus on mental health into general healthcare facilities so that individuals can receive support earlier and more conveniently. Training nurses, conducting community sessions, and integrating mental health support with local networks have proven to be highly effective strategies. So we have positioned ourselves by ensuring to provide more care, more trainings to various persons within the community. However, despite our efforts, more inpatient care still is needed in order to provide the necessary care to our community. Now let's look a little bit at what other countries have been doing to improve their mental health care. For example, in the Netherlands, they have integrated more mental health care in primary practices. Australia have heavily invested in suicide prevention programs, community-based crisis responses team, and focused on early intervention. In Canada, mental health literacy programs have actually been embedded into the school programs from an early age, which has reduced stigma and has built a more supportive society. And in the USA now has an aspect of teletherapy, whereby mental health is now recognized in work policies and have proven to be an important enhancement. These examples show that solutions exist. We can learn from these initiatives and adapt them to fit St. Martin's unique cultural and economic landscape. Now, let's look at what could be done for mental health and suicide on our island. Solving our mental health crisis will require a multifaceted approach. Here's what we must do. First of all, let's focus on expanding the mental health infrastructure. For example, by investing in more psychiatric beds, inpatient facilities, community-based mental health care services. For example, thus far the mental health has begun expanding such, for example, by working together with the social services department. So many of us, we actually go into the communities and offer mental health services by the various help desks. So this is something that we as psychologists do, but this is also something that can be done on a more global scale amongst other professionals as well too, so that persons can feel more comfortable receiving the care and that they don't per se have to come to a mental health facility or a private psychologist. For example, persons can receive more care within their communities. Also, we can go about doing such by increasing awareness and education. For example, by teaching mental health literacy in schools and workplaces to reduce stigma and encourage early intervention. We can also do this by improving access to care, as indicated earlier. And then finally, address substance abuse, recognizing that addiction is a disease and provide more rehabilitation and prevention programs. Now let's talk about a way forward addressing suicide prevention. We must first understand that suicide is complex and cannot be addressed through a single preventative intervention at only one level. Our recommendations emphasize this complexity as an important intervention at different levels. The different levels are universal, which represent the entire population. Then we have a selective approach, which specifies, for example, specific target groups. And then finally, an indicated approach, which represents specific individuals with suicidality. For an island like St. Martin, the coordination efforts across the different levels can help address the suicide effectively. So I'll now give some examples on each level. From a universal perspective, the audience, for example, then represents the entire population of St. Martin. So How we can address it on an overall basis to the entire St. Martin is, for example, by increasing public awareness. For example, the government and local organizations can run media campaigns through TV, radio, social media to raise awareness about mental health, stress management, and reduce and increase available resources for suicide prevention. Then we can also go about it, for example, by training first responders. For example, by providing training for the police officers, firefighters, teachers, and other first responders to first of all recognize the signs of mental distress and suicidality, and also how to respond to such appropriately. Then let's go a little bit to talk a little bit about the selective prevention, which represents a targeted audience. For example, the at-risk groups. The targeted audience can be, for example, by working together with specific groups such as adolescents, elderly persons, substance abuse persons who struggle with substance abuse, or persons who have experienced trauma. These groups can be identified through schools, healthcare providers, and community organizations. We can also address these, for example, through screening and early intervention. We can go ahead by conducting mental health screeners in schools, workplaces, and healthcare settings to identify individuals who may be struggling with thoughts of suicide or even mental health issues. And then finally, through youth mentorship programs, so for example, by involving mentors from within the community who can connect with youth at risk, providing guidance, emotional support, and helping them develop a sense of belonging and purpose. And finally, indicated prevention, which the target is individuals with existing suicidal behaviors. Individuals who have already exhibited a suicidal behavior or that have been diagnosed with a mental illness. So we can go ahead by addressing such by, for example, having crisis intervention and support services. For example, by having hotlines and allowing these persons to have access to care when they need. And then we can also do so by having support groups for families and these individuals that are at risk. In conclusion, it is our collective responsibility. It is our shared responsibility to create a good mental health and address the mental health challenges within our community. It is time to take charge. It is time to change the way we think about mental health. Seeking help is not a sign of weakness. It is actually a sign of strength. By working together, the governments, healthcare providers, educators, businesses, and the public, we have to build a society where mental health is treated with the same urgency as physical health. Let us break the silence together. Thank you.
Thank you, Dr. Lambert. You said a lot. You mentioned, for example, the challenges that we have on St. Martin, the limited mental health resources, the cultural barriers, the financial and structural barriers, that there is a lot of substance abuse and addiction and a lack of early intervention. But most importantly, how can we solve our crisis? Expanding mental health infrastructure, increasing the awareness, and address the substance abuse. Dr. Lambert mentioned 3 different approaches. The universal approach, increasing, for example, public awareness, media campaigns via social media, training first responders, training, for example, the police officers, firefighters, teachers. Also, for example, the selective approach, people that have experienced trauma, early screening, and giving people a sense of belonging and purpose. And then lastly, we have the indicative approach, having crisis intervention and support services, having, for example, hotlines, access to the care when they need it. As Dr. Lambert mentioned, let's break the cycle. I now go over to our next presenter, Dr. Tashina Thomas Macau from Turning Point Foundation. You have the floor.
It's on? Oh, okay. Good morning, members of Parliament. Good morning to those of you in the Tribune, those listening. Good morning. Suicide prevention and mental health. Suicide is a major global issue, claiming many lives every year, and I think my colleague said a lot. In the United States of America, suicide is one of the leading causes of death, especially among young people, according to the WHO, the World Health Organization. More than 700,000 people commit suicide each year, and rates among young people have increased significantly over the last decade. Behind these startling statistics are lives, families, and friends who feel the impact of the loss. Without a doubt, suicide prevention is vital. St. Martin has also seen an increase in suicide over the last few years, with social issues and the resultant mental health problems on the rise. Urgent community intervention is required. People are most motivated to end their lives when they believe that there is no hope left in their current circumstances, and that there is nothing they can do to improve themselves. Suicide is frequently caused by depression, substance misuse, financial issues, traumatic experiences, bullying, unemployment, interpersonal issues. A lot of it is from social issues, and which we do have. Dr. Lambert spoke a lot about the issues. I'm going to go into the proposed solution to the current issues. Number one, mental health resources must be given top priority. Support for mental health should be a regular part of life, not something that should only be provided during times of crisis. We should normalize discussion about mental health in schools and workplaces. Early instruction and coping mechanism, emotional well-being, and the value of getting help can influence students' view about mental health for the rest of their lives. Organizations can develop work-life balance rule, offer private counseling services, and train managers on mental well-being. People are more likely to seek help when they need it, when psychological treatment is integrated within their organization. Workplaces and educational institutions frequently emphasize on performance and great results. However, mental health is what gives those things their sustainability. Stress worsens without the right support, which can result in disengagement, burnout, depression, and even suicide. Real cultural transformation occurs when emotional self-care is viewed as an integral component of both work and education rather than the disruption of one or the other. Stigma. We speak a lot about stigma, but stigma still has to be decreased. Though it manifests differently in each culture, stigma around mental health issue is evident everywhere. Therapy is either unheard of or within some groups viewed as a sign of weakness in others. And the reason why this is here is that St. Martin have so many different cultures, and what I've recognized in dealing with some persons, especially when we're looking at the Haitian culture, something happened last week, but it's something that keep happening. What I've realized is that they don't quite understand mental illnesses. So they will see it happen in their families, but will be unable to pinpoint exactly what it is. As recent as last week, someone had suicidal ideation, and the mom said, I have to take my daughter to the doctor because she had fever and I think it went to her head. So all of these things we have to look into. Social reaction to mental health problem and treatment greatly influence help-seeking behaviors of those within the community. Without normalizing mental health intervention, harmful self-soothing behavior become more common, leading to additional issues such as substance misuse and its resulting negative impact on mental health. Give me 1 minute, my computer. Sorry about that. Effort must be also made to ensure intervention and culturally sensitive to avoid further misconception about the effectiveness of mental health treatment. Translating and adapting material are some ways to overcome these barriers by developing digital platforms that give therapy in several languages or linking consumers with therapists familiar with our culture differences. Technology can also bridge gaps where traditional programs fall short, making mental health care more approachable for those who might otherwise feel excluded. Now, we got to speak about social issues, and social issues that impact mental health must be addressed. Poor mental health is a result of underlying issues, many of which arise due to deficiencies within our community, proper economical support and condition heavily impact households. Affecting the mental health of parents, an impact is done as well to their children. So we see a lot of children carrying the burden of their parents, the social issues that are felt in a household. This can impact exposure to things such as abuse or increase risky behaviors that can lead to both mental illnesses and crime. Affordability and accessibility regarding mental health treatment also impact help-seeking behaviors. Now, Dr. Lambert spoke about just now addiction. Addiction in our law is not seen as a mental illness. All right, so one of the things that we want to curb is, one of the things that we want to fix is our legislation where addiction is seen as a mental illness, because that's how it is in the rest of the world. Addiction is a mental illness. Intervention for issues such as substance abuse disorder should be accessible to low-income communities who may already lack sufficient education regarding mental health and its appropriate treatment. What preventative measure must be put in place? Strong prevention campaigns. Teach coping mechanism and how to solve problems in school and in the workplace. Make mental health and addiction a part of our school curriculum. Encourage social emotional education initiative. Strengthen family ties. Provide parenting skills. Encourage resilience by means of education. As parents or family members, we must foster a culture of dialogue around this topic, helping people find a sense of purpose or strengthening their connection to spiritual beliefs as well. Finding a purpose contributes to improve mental health and emotional health. Create programs and place to maintain community wellness. We all have a responsibility to prevent suicide within our community. It is not only up to the professionals. It can mean the difference between life and death if we pay attention, offer support, and act when we see warning signs in our loved ones. There is hope and support available if you or someone you know is having difficulties coping with life. One of the questions that was asked by the committee was to explore and bridge the gap, find out the correlation between the correlation between violence, crime, substance abuse, and suicide. Alcohol and drug use disorder have been found to be strongly associated with the risk of suicide. Although it is challenging to assess the relative influence of mental illnesses on the risk of suicide, one potentially significant risk factor for suicide among substance abusers is their tendency to turn towards violence. About 75% of those who start addiction treatment say they have acted violently, which is physical or attacking others with weapons or robbery, because of the substance use. Additionally, recent studies suggest that relationship between substance misuse and suicide risk may partially be explained by violence, the way they express themselves. Behavioral issues are associated as well. The type of individuals in our community who commit crimes because of mental illnesses can be separated into 3 categories. Those who have a mental health problem with symptoms and behaviors that increase the risky behaviors, those who commit crime under the influence of substance, and those with both mental health and substance abuse problem that intensify their symptoms and behavior. Those with mental illness who sometimes use drugs and have antisocial personality traits or disorder are more likely to conduct crime like rape, trespassing, theft, and murder. Schizophrenia patients may also harm others by acting on their delusion, and the danger is significantly increased by co-occurring substance abuse or dependence. When we, as a community, observe that someone is a threat to the community, we can decide to assist and guide them immediately instead of waiting for the crime to be committed. Persons within these high-risk groups require intervention long before the resulting arrest. Since these individuals already struggle with issues such as isolation, rejection, and the general disconnect from society, when they enter prison, rehabilitation is fundamental to avoid issues of recidivism. If appropriate treatment is not provided and their minds are not changed to alter their behavior, the core issue cannot be addressed, leading to a continuous crime and second chance, second, third, and fourth offenders. Turning Point can serve as the ideal illustration. Most of our clients have multiple diagnoses and enter the legal system because of these unresolved issues. Many cases involve criminal activities, exemplifying the direct effect of mental illnesses and substance abuse problem when left untreated. To significantly reduce crime, risk factors and high-risk groups must be addressed. Rehabilitation within the justice system is crucial to remedy ongoing issues of addressing these social problems after they have already negatively impacted our community. Thank you.
Thank you, Dr. Maku. You have mentioned and proposed also a few solutions. I will just mention a few. Mental health resources should be a regular part of our life. It should be a priority. Create a digital platform to have, for example, therapy in the different languages. Technology can also bridge the gap. Addiction is a mental illness. Make changes to the law. Strong prevention campaigns. And also the connection of substance abuse and suicide. I have seen that we have many viewers watching this roundtable discussion about suicide prevention and mental health, and I've also been informed that even the clients of the Mental Health Foundation are currently watching and tuned in. We now will go over to hear from our representatives of Teen Times organization on their perspective on mental health and suicide prevention.
Hi, my name is Rohan Goswami, and I will be representing Teen Times for this roundtable discussion on mental health and suicide. I think the concept of mental health in general is just not spoken about enough. There's sort of a taboo that's placed around it where if it is brought up, it's shut down immediately. And oftentimes the reasoning behind shutting it down are things like there's food on your plate, you have clothes to wear, you have a roof on your head, which are very important things. But aside from physiological needs, I think it's really important to recognize the need for mental health awareness. And the only way to combat lack thereof awareness is to increase education. And what's the most ideal place to do that would be our schools. I think things like sex health is also discussed in schools by means of workshops such as Real Talk and Girl Power. I think mental health can also be implemented in one of these workshops, and it can definitely help to boost awareness and also maybe provide resources to students who might be secretly going through something for them to get help either in school, in their personal life, a trusted adult, other resources, anonymous resources would be ideal. And that would definitely make a very big difference in terms of educating the population and just being more aware of mental health as a whole. Thank you.
We will now continue to hear from our representatives of the Seventh-day Adventist Church on their perspective on mental health and suicide prevention.
Hello, everyone. My thoughts on the increase in suicide numbers in St. Martin. Well, especially amongst our young people, I think it reflects the pressures that they're under in terms of whether it be going through school or being a teenager or going through the adolescent years. I also think it reflects the lack of support that they have, lack of foundational support, whether it be from a community structure or whether it be from a strong family backbone. I think a lot of families have been broken up, unfortunately, and that takes away a lot of support for our young people. As it relates to mental health cases or mental health and how the island has dealt with it, I think the island has made strides in recent times, but there's much more education that needs to be done in terms of helping the public understand what and how important it is for us to take seriously mental health issues. What I think our leaders can do? Well, I think for one, recreational spaces are needed, or more recreational spaces are needed. I know we have beaches and so forth, but maybe another park that can just help people to unwind and relax, free of cost, just go and get away from the pressures of the day just for an hour. I think that will help massively.
I would like to thank the panelists for their presentations and also thanks to the youth and the representatives for submitting their videos. I now open the floor to the members of Parliament. As mentioned, for this discussion, I believe that a more dynamic exchange would be appropriate, so members should ask their question, indicate, if necessary, to which panelist the question is directed, and one or more panelists may respond. Panelists may also rebut the response of other panelists if they so wish to. Time will be monitored accordingly. I will give the floor to our first Member of Parliament, MP Westcott Williams. You have the floor.
Thank you, Chair Lady, and a good morning to my colleagues, a good morning to those persons in the tribune, a good morning to all tuned into this meeting, and of course, a very good morning and words of thanks to our panelists this morning, Dr. Thomas McCoo and Dr. Lambert. Thank you both for your presentations. And I am sure, and for both of you, I know it's a fact, and Dr. Thomas McCoo in particular, that you probably have lost count of the times that you have been asked to make a presentation on this particular issue. And I guess it's beginning to count the same way for Dr. Lambert as well. Nevertheless, I thank you for still smiling under the circumstances. And I would like to know if the work that you have been doing and your advice and your professional opinion on the matter of mental health, if these have been taken along in the drafting or updating of our mental health policy. So our mental health policy of 2018 is being updated with the assistance of PAHO. Have you been involved in the updating of our mental health policy? A similar question pertains to the mental health facility to which Dr. Lambert referred. That is, of course, part of the NRPB/Trust Fund program. And there too, what is your involvement? Because this mental health facility is not only about the facility. Many of the things that you have mentioned, awareness, education, capacity, etc., are to go hand in hand with the proposal for the facility. So again, what is your input into this particular project? In 2022, or maybe early 23, there was a Kingdom Mental Health Conference with many participants from throughout the kingdom and recommendations. Again, the recommendations we're hearing from you this morning are also, many of them are also in that document. Do you know of this document that was prepared as a result of that conference? And is it being worked on? And I say this with some concern because we had a mental health policy 2018. Was it ever evaluated in whether we were able to make any progress on the basis of that policy? Now we're updating it. So the monitoring and the evaluating of steps to be taken, is that happening? Do you get a feeling that that is happening? Is there any type of a national body that monitor these recommendations regardless to how they get to you, whether by a kingdom conference, whether, are you part of such a body that not only make recommendations, but can somehow see and evaluate whether we are making steps and whether we are making steps in the right direction is my question. I want to address the issue of addiction and mental health. And I have a question to Dr. Thomas on this matter. We have spoken about it before. And I have also spoken to the relevant ministers regarding this, because as long as addiction is not treated for what it is, which is an illness, and coverage is given for that, then we're not close to where we would like to be. So the question is, Dr. Thomas, is there any change? Has there been, until we get a relevant legislation in place, has there been any flexibility with assisting with the coverage for addiction, treatment of addiction is my question. And then I would like, and through you, Madam Chair Lady, to Dr. Thomas, and maybe Dr. Lambert is also involved. And Dr. Thomas, I would understand if you would say to me, MP, I would prefer not to address it right here, right now, but I can inform you in a different setting, maybe. I would totally respect that. But I would like to know, talking about addiction, Turning Point's view on the potential legislating of cannabis. I would like to know your position on that. Of course, Madam Chair Lady, I've read, and that is what I am not only concerned about, I would like to know, I've read apparently a discourse between Turning Point and the promoters of the legislating of cannabis. And I would like to get to the bottom of that. That's what I was referring to when I say maybe Dr. Thomas would say, MP, I would prefer not to address it here in this open session. I will totally respect that.
Chair, MP Westcott-Williams.
Yes, ma'am.
I would like to make it also clear that I didn't mention it in the previous mention, but the idea first was to have the members, because I want it to be interesting debate, interactive.
Okay.
And if to have like 5-10 questions will be a little bit too much. So first I had one question, but seeing that there was other panelists that didn't present, I said, okay, I will give more flexibility, but it's not the idea to have like a lot of questions, because
there are not many questions. That's
yes.
a long statement,
Yes.
maybe,
I
but
have
very
3 or 4
specific questions. Yeah,
questions. So
not more than that,
if you
for
can
sure.
round off, please, then I can go to the
I
other
am.
members.
I am. In fact, that was it. My the last one specifically, and whether the ladies can address them in here, or if not, I will totally respect that as well. Thank you.
Thank you, MP Westcott-Williams. Would you like to answer the questions right away, and then I will go over to the next member? Yes, okay. To which panelist can I give the floor? Okay, Dr. Lambert, you have the floor.
Madam Chair, I would like to address the question posed, which is a very interesting question regarding what has been done thus far and have we been involved in the process regarding the elevation of mental health on St. Martin. So I must say, big shout out to Minister Otley. I know when he was in government, that is when I noticed that a lot of the increase in awareness in mental health has started off. I do recall, for example, we had the mental health week where we had like various conferences where various stakeholders came together and we basically put all of our ideas on the table. And it's through such, that is where the document, which is MP Westcott was referring to, was developed. And I must say that is where, besides that, there's also been persons from the World Bank that came into the Mental Health Foundation and asked a lot of us clinicians, but various persons within the mental health, what is our input in how we want the facility to be developed. So I must say through his tenure, there was much done. Now, it was then MP Veronica Janssen, she was then in leadership, and then I noticed that she was able to work really hard towards ensuring that we got more funds towards the Mental Health Foundation. So we were very proud and very thankful for that contribution. And now that we have Minister Richnel Brugge, who is now in leadership over the Venesa ministry, we are now basically building on what has already been done thus far. So we have, for example, the team of Trimbus that came in, if I'm not mistaken, about 2 months ago, and he's had various discussions with the team. Trimbus have had various discussions with various stakeholders within the mental health industry, and now we're thinking of solutions on what can be done and how can we execute what has been proposed in the plans that have been done so far. So to answer your question, we have been involved in every process along the way, and we look forward to build on what has been done. And based on what I'm seeing thus far, things are looking and going in the right direction. Thank you.
Thank you, Dr. Lambert. I now give the floor to Dr. Maku. You have the floor.
Yes, I would like to second what Dr. Lambert said. Indeed, we have been a part of those discussions. And as recent as last year, we sat in meeting concerning the draft ordinance, to make some changes in the legislation. So I don't know how far that is, but it was discussed. In terms of your question on addiction and the whole marijuana legislation, I can say that Turning Point took we made a decision to be very vocal with that is concerned because we see the social issues in our community. That's number one. Number two, we do not have the appropriate facility. And so let's fix what needs to be fixed first before we put the cart before the horse. That would be my stance on that.
Thank you, Dr. Maku. I'm seeing that MP Westcott Williams would like to respond, or the one question wasn't answered. Yes.
Actually, to get some clarification, Dr. Thomas said that you have been involved through you, Madam Chair Lady, in the drafting of the ordinance, and that one I'm asking if you were referring to the one to include addiction, so the new healthcare ordinance. I just needed to get that clarified. That's the one.
The mental health ordinance, right?
That is the one. Yeah.
Okay, thank you. I now go over to the next member of parliament, MP Doran. You have the floor.
Thank you, Madam Chair Lady. Good morning, colleagues. Good morning to Ms. Thomas Maku and Ms. Dr. Lambert and Dr. Thomas Maku, and special good morning to the people of St. Martin that are tuned in. I have 3 points that I would like the feedback from the professionals on. The first one being, I know that in Curacao, I was told that there's a sort of a institution where if you are very depressed or going through potential suicidal thoughts, that you can go there and I would use the word rest for about 2 or 3 weeks, depending on the situation. Does the Mental Health Foundation have a particular department or area for such, or is that something totally different, or are you not aware of this institution? And if not, what would you require to maybe introduce something like that here for persons that might have these feelings? My next point I would like to ask clarity on is, do you believe that mental illness can be passed on through genetics? Lastly, no, one before the last, we've heard that 76% of the mental cases tied to marijuana. I would like to know if there's any truth to that, or if there's any data to support that statement that we've been hearing. Lastly, based on your professional opinion, we've heard that, marijuana abuse tend to wake up schizophrenia in persons that have not displayed any signs of it, but have it maybe run through the family or have it download that this can come out. Is that so, based on that opinion? And how does stress tie into mental breakdowns? And are these mental breakdowns then permanent, or these are things that can be treated? Those are the points that I have, and thank you for the opportunity.
Thank you, MP Doran. To which panelist can I give the floor to answer MP Doran's 5 questions? Dr. Lambert, you have the floor.
All right, Madam Chair. Thank you, MP Duran, for your questions. Okay, thank you, first of all, for bringing the awareness regarding the facility that is offered in Curacao. I oftentimes say, we can learn from those that are a little bit more advanced and what has worked and what has not worked for them. Now, regarding the place, 2 things. We at the Mental Health Foundation, we indeed have an inpatient facility where you can voluntarily admit yourself if you feel highly distressed. We try, however, to take more of a community-based approach. So instead of, for example, having persons voluntarily admit themselves, we try to offer the opportunity for our staff to go out and support persons within their respective communities. Now, if that approach per se may not be as effective, persons indeed, once demonstrating to have a sort of mental challenge, do have the ability to voluntarily admit themselves, and whenever they're ready to be released, they have the opportunity to then be released. So that is that option. That is that question regarding, do I believe that mental illnesses are genetically passed on? Indeed, research has shown that a mental health illness can be, well, in most cases are genetically predisposed. However, it's similar to any other illness, not per se because you have it in your genes mean that you would be automatically prone to developing an illness. Oftentimes, it can be drugs or a extreme stressful or traumatic event which can trigger on the illness. So, but oftentimes it is already predisposed. But in some instances, you have some persons that may have encountered, for example, a very stressful situation, and you call it, for example, like acute stress disorder. So this person may, for example, experience a heightened reaction, but that does not per se mean that this would be an experience that the person would encounter for the rest of their lives. It will then just be a reaction to that event. However, if it's more genetically predisposed, oftentimes, for example, that person will then respond to an event oftentimes through anxiety at multiple phases of their lives. So I'll go ahead and pass the floor to Dr. Muku.
So through you, Madam Chair, MP York, thanks for your question. Like Dr. Lambert say, yes, it can be passed on, and sometimes you do not see it until the person becomes or in a situation where they're really stressed, or sometimes through substance, you begin to see that pass on to them. You were asking about induced schizophrenia. So we work very closely as well with the Mental Health Foundation, and I could tell you one thing. We have 15 clients, and out of the 15 of our clients, 9 of them are dually diagnosed. So that means to say there is addiction coupled with a mental illness, okay? Prior to 2020, of course, there has been a change in our clients, and we see it. We see where prior to 2020, our clients were addicts, 66% of the clients, but then that is the younger, our younger clients, because we have from anywhere from 15 to 24, you will see most of that. And then, of course, with the others, you see it with alcohol and crack and cocaine, the harder drugs, pills. Yeah? So I hope that answered that questions. And I think Dr. Lambert answered your 2 other questions. Or you had one more?
There was one more. I don't mind addressing it.
Okay, go ahead.
The question was how the stress breakdown in mental.
Oh, yeah.
The final question indeed was how the stress breakdown in mental illnesses. At the end of the day, it all boils down to level of resilience. 2 persons can go through the exact same experience, but it depends on how resilient you are, determines how you will respond to it. But also, as you asked, as it pertains to if genes play a role, if you have a mental illness already predisposed within your genes, you're more likely to respond more severe compared to someone that may not be genetically predisposed to a mental illness. Thank you for the floor.
Thank you. MP Dorad would like to, one question wasn't answered, because I think one was missed.
Yeah, no, the question was recognized, but I think maybe it wasn't clear in terms of the response. So what my question was, let's just give an example. Someone that is perfectly healthy, deal with something very stressful. Can the stress cause mental illness, and will this then be permanent in terms of your professional experiences or any science? Can this then be permanent, or is it just like, as you mentioned, a one-time situation? Thanks.
Okay. Dr. Thomas, you can answer.
Say yes. MP York, what I've seen as well is because stress creates imbalances, right? So, most of the time you're super stressed, it creates hormonal changes. You have chemical imbalances, and so you begin to see the person become super depressed. That, of course, it leads to depression. They remain in that state for a little while. But I believe with the right help, especially if the person detected it or the family member detected it, they do not stay in that space for a long period of time. So the person as well have to admit that, hey, you know what, something is happening with me. Yeah, and then, of course, seek help. In our case, and we wait a while before we seek help. But if help is seek one time, it can be addressed.
Thank you, Dr. Thomas. Just for the records, they are family, but it's MP Doran, just for the records that we have it on paper. Okay, I now go over to the questions from MP Lewis. MP Lewis, you have the floor.
Good morning, Chair. Good morning to my honorable colleagues here. Good morning to those in the Tribune. And a special welcome and good morning to Dr. Thomas Maku and also Dr. Tamika Lambert. It is good to see young people that carries the title doctor. It's always a pleasure also having a discussion with Dr. Thomas Maku, as we have history as trainees at Princess Juliana Airport over 20 years ago. With that said, and not wanting to get what we would call a boche from Madam Chair, as I have prepared my questions, they are not 3, they're not 4, but it's a discussion. What can be answered, what cannot, but I would like my questions to be posed. And it also derived from the presentation from the 2 doctors here sitting today. My questions now posed to the Mental Health Foundation. I hear everything about the suicidal part that we all know about. We hear about addiction that we all know about. But when we're sitting here in the House of Parliament, we're also talking about statistics and also basically you need money. Okay, so we was talking about what is the subsidy amount that MHS receive from government. Okay, and what is the difference between the amount that MHF receives compared to your counterparts, as you also mentioned about that you all receive the lesser amount compared to the neighboring islands or the Dutch counterparts. How many clients are currently being treated by MHF? I recently heard 15 at Turning Point, but I need to know on a global scale how much is being treated also at MHF. What is MHF current house capacity? So how much do you, before you have a new facility basically in the work, but how much do you currently house at this moment? Does MHF have a function book? If yes, what is the current capacity do you have regarding personnel? And can you give a breakdown in the categories regarding the functions? So I know you have the nurses, I think you have those, the psychologists or psychiatrists, etc. So say, for example, how much do you have now and how much do you actually need when it comes to the FTAs? How many community sessions does MHF hold per year? And what are the courses does MHF organize for its personnel? What is Mental Health Foundation's plan to improve access to care? And do you have an initiative or
MP Lewis, I know you're going very fast, but I'm seeing they're typing very fast
I can
as
send it.
well.
I can send it.
Yes, I would like them to be able to answer your questions and not
Okay.
half answer them either. So, yes.
But they're very direct. It's derived from their
Yeah, okay.
presentation. Okay. So what is MHF plan to improve access to care? And do you have an initiative or proposal for government, by extension, the Ministry of VSR? Does MHF have a plan or a draft plan for suicide prevention? And I can recall, as a former police officer, I have assisted MHF on many occasions outside and also in-house at MHF with non-compliant clients or patients. I can say MHF, those was in the begin stages of MHF here on the island. And I would like to know presently how involved is law enforcement presently in collaboration with MHF.
MP Lewis, before you continue, I just want to see the idea behind this panel discussion. It's focused on their expertise on the topic. So I know you have a lot of questions which are very valid, but in regards to this topic, I would like to ask you to, the reason why the professionals were invited is to give their expertise on how we can, as members of parliament, tackle the current issue at hand. So if possible, could you make sure that the questions are focused on that topic?
It is my
Thank you.
questions, Madam Chair, is directed based on the fact of the presentation, because I typed my questions as they were talking. I am paying attention. It's a discussion, and I think it's very important that these are mentioned. I am not going to reiterate every single thing that everyone is saying here. My questions is totally different, and that is what I conclude for MHF. And I will go on to the points for Turning Point. Through you, Madam Chair, to Dr. Tashina Maku. What is the percentage of suicidal death in St. Martin? Or how many individuals have taken their lives, you can say, in the past 5 years? I see this discussion as a discussion that we need to know statistics and also come up together with proposals and initiative on how we can tackle this together with the professionals. What is also Turning Point's current capacity? And I did understand that individuals can't, so please correct me if I'm wrong, but I understood that individuals can't admit themselves unless they commit a criminal offense at Turning Point. Is this information accurate? If yes, please explain why. Does Turning Point give home services? As it was also mentioned that MHF would also propose that they go to the respective areas or communities to deal with certain individuals' issues. And the last question for Turning Point, what type of crimes does these clients or individuals commit in order for them to be admitted at Turning Point? With that said, thank you, Madam Chair.
Thank you, MP Lewis. Professionals, are you able to answer questions of MP Lewis? And to which professional can I give the floor?
I will respond.
Dr. Lambert, you have the floor.
Yes, thank you so much. I will respond. First of all, thank you so much for your questions. I will respond to the questions that I am able to within my respective position at the Mental Health Foundation. Please note that I'm the clinic coordinator and not the medical director, and I'm also not the finance director of the Mental Health Foundation. So while I do sit in many of the meetings that involve this information, I'm also a clinician. So my main focus is focusing on ensuring that the clinic is running smoothly and ensuring that the clients in St. Martin are treated efficiently. So I will respond within the questions that I'm able to respond off the top of my head, and the questions that were posed, I can by all means go ahead and send this information in for your reference.
Is that okay, MP Lewis? Okay.
All right, thank you. Now, as it pertains to the function book, I will share that at the Mental Health Foundation, we have various departments. I will share the function book specifically within the clinic at the Mental Health Foundation, which also will identify the services that we offer. So, for example, we have psychologists, psychiatrists, nurses, social worker, and occupational therapists. So these are the services that are offered within the clinic. As it pertains to what are the courses that are offered, so at the Mental Health Foundation, we do have a budget allotted specifically for professional and educational development. So each clinician has the opportunity to further their education with various trainings every year. So each of us every year are required to attend various courses. So that is one thing that we ensure to uphold the clinicians, to ensure that we provide the most updated care needed. And also, what is the suicide plan as it pertains to the mental health care? So we have, all clinicians have a suicide preventative plan for when clients come in. For example, we have, if a client is suicidal, the client then goes based on the triage system that we have, so that client has first access to receive the necessary care. Although we have a waiting list, and the client must be seen within the same week, and the client must be contacted within 24 hours. And oftentimes clients have the ability to call the crisis number and receive 24 hours support. And with your permission, Madam Chair, I would like to welcome my colleague, who is Mr. Marcel DeWint, who is actually one of the nurses that work in the field, and he works directly with the police officers. So I would like for him to share his experience on how it is at current working alongside with the police officers.
That's okay.
Go ahead.
Mr. DeWint, you can you can add yourself to the conversation. You can, is it working? You can press the button. Yes.
Questions would come, so I was a bit prepared for it. A lot of questions, MP Lewis. The main topic is suicide, I think. So, based on that, my profession is socio-psychiatric nurse. I'm a case manager at MHF. And I also do crisis interventions, so we have 24 hours per day. We have our phone ready for incoming calls that can be related to disturbed people in the community or at the police station, at the hospital, wherever the situation might be. And when it comes to depression and suicide, since, let's say, October, November, where we had a sad fatal suicide from a young girl in St. Peter's, we see at our crisis line also an increase in calls and plenty of young people who also attend the same school or the surrounding schools. And that is sad development, because I think we almost have every week now calls, and we have to address with my colleague who is a youth psychologist, Giselle Cotterington. We have to manage together with the children and the family and the schools to reduce those depressed feelings and the other topics that they are stressing with. That part said, coming to my work in the community, we have 4 case managers, and together we have more than 240, 250 clients that we have to support in the community. Some need medication, some need follow-ups, motivational conversations. And also every week we receive calls from the police in which we are asked for support to deal with confused persons who are maybe psychotic or under the influence of alcohol, drugs. And since some years now, the support of the police is, the understanding of the police when it comes to mental health issues is improved. That comes because we had some mutual trainings about it. I think a lot of police officers were dealing with how to support a confused client, how to deal with persons who are under influence of alcohol, drugs, and we shared some stories, which was very helpful. There are times that our safety is at concern because the client is confused and might react aggressive and want to attack me as a nurse or family members, and then we would ask the police to restrain the client. However, they are not always obligated to hold the client, and then there comes friction of the responsibilities of both parties, we as mental health or the police. And that is an ongoing topic that is addressed, I think, every week. And that is a very important question because we do not feel safe all the time. And the police cannot always, by law, do the things that are needed at that moment. And that is, in our opinion, restrain a client with force. It's a lot of words, but... And I think we can talk for an hour further. But.
Thank you, Mr. DeWitt.
All right. Thank you so much, Marcel. Thank you, Madam Chair. So as indicated, I just thought it was important that Marcel shared the kind of work that he does, him and alongside with the other crisis nurses that work within the community, because a lot of the work that we at the Mental Health provide is through the community rather than trying to have persons come to the Mental Health Foundation, because we try to take more of a preventative measure rather than allowing persons to reach to such a devastating state and then provide them with the care. I did want to add one of the questions that you requested with that you asked, Mr. MP, was what are various presentations or different acts that we do within the community to promote mental health. The requests for mental health presentations are a lot. We get a lot of requests, and I know one of the requirements for all clinicians within the clinic is to provide at least one presentation yearly. So we provide presentations at various schools. We oftentimes have radio programs. I myself had about 3 of them last week, various presentations. Also various workplaces. So oftentimes workplaces send in requests for us to have various workshops to their staff. And also, finally, we have, for example, at churches. And a lot of times when there is a tragic incident that occurs, we at the Mental Health Foundation then goes in and assist the school or wherever this situation occurs. And finally, what I would like to close off is by sharing that at the Mental Health Foundation, we have 5 psychologists, so 2 adult psychologists, 2 child psychologists, and we have 1 psychologist that works in all departments. And then we have 1 full-time psychiatrist, and then we have 1 that is visits from Curacao. And we are actually looking for another psychiatrist, because keep in mind that not only does the crisis nurses work around the clock, we have the psychiatrist that also works around the clock for the crisis line. And then we have 1 occupational therapist who provides those services. And I hope I was able to answer most of your questions as efficiently as possible. Thank you, Madam Chair, for the floor.
Thank you, Dr. Lambert. The remaining questions, if there are any, will then be sent via email. MP Lewis is in agreement with that. I will now continue with the next Member of Parliament, MP Labega. You have the floor. Oh, there were also, sorry, my apologies. Before we come to MP Labega, Dr. Thomas, you have the floor to answer some of MP Lewis's questions.
Through you, Madam Chair, to answer MP Lewis' question. When it comes to the percentage of suicide, I don't quite have those data. That comes from VESA, and I don't want to quote the wrong thing, because I think we have more since then. What is Turning Point capacity? We have 15 inpatient clients, so those live at the facility. 237 outpatient. So they come in for counseling, anger management, different services. Sometimes they're sent by their employer. Yeah. And then, of course, the schools, the testings, and the school education. So I did not even count those. Does a person have to commit an offense to be admitted to Turning Point? No, a person does not. However, since 2016, Turning Point is no longer on VESA budget. So we have currently 15 spaces. So we give, of course, justice system have priority. We are subsidized by them, so we give priority there. However, if a client comes to us and we see the need for it, we tell the parents, listen, we're going to assess the client. The psychiatrist has to assess the client with the psychologist, and then we advise that the parent, of course, go to the courthouse, that the judge can have a mandate. So for them to be in Turning Point, yes, a mandate has to be given. And of course, they have to stay the year. In 2013, one of the things that the inspectorate said was that we cannot have those clients from justice and the volunteer clients together. We cannot mix them together. And so we are a small institution. So of course, most of the clients that are in there now are clients that came in through the judicial system. Does Turning Point give home services? Yes, we do. And of course, once our client leave there, then we have aftercare programs, so we follow them through. What type of crime does the client commit? There's different crimes. There's robberies, there's rape, there's murder. So we have a bit of, yeah. I hope I answer your question, MP Lewis. Through you, Madam Chair. Thank you.
Thank you, Dr. Thomas. I now go over to MP La Vega. MP La Vega, you have the floor. Your mic, MP La Vega. Yes.
Still not.
Yes, you have the floor.
Okay. Good morning, Madam Chair. Good morning to the Scafir, my fellow colleagues, and good morning to the two doctors that have presented here for us today. I have questions pertaining to the difference between mental health issues with males and females. I know quick searches may show that women are more likely to experience mental health issues, while men are more at risk of committing suicide. If this is so, does this affect the way that the organizations approach their strategic treatment methods, especially with the younger generation, if they see an increase in this? Obviously, we live in a society where men don't express themselves much, and while women may, and then that's why the percentage is more with women, and men may just go straight to that extreme of suicide. So that would be great to know. Also, last question, when it comes to the outlook on the cannabis pending legislation, I know there's been a lot of talk. Now, cannabis is here, and I don't see it going anywhere anytime soon. So is it a matter of the being concerned that it will blow up to where you think there'll be more mental health cases, or is this something that the two organizations had already been aware of? Because I've never heard of any campaign or any push to get, I don't know if it's more concerned with the younger generation away from smoking or just the population in general. Because without the cannabis legislation, if it doesn't come, there will still be a smoking issue, if you guys foresee that. So do you guys plan to campaign against the negative effects of it, or doing it responsibly with or without the bringing of this legislation? And that will be it. Thank you.
Thank you, MP La Vega. To which panelist can I give the floor? Dr. Lambert, you have the floor.
All right, Madam Chair, thank you so much for the floor. Now, interesting question regarding the differences between males and females regarding mental health illnesses, I would say this. There's not a difference between the fact that there are more women that have mental illnesses versus men. The difference is that most men go untreated. So a lot of men go undiagnosed because indeed, as you yourself mentioned, most women are more prone to seek help, whereas in men usually try to cope on their own through substances or various addictions. So with that being said, a lot of times women indeed do attempt to commit suicide, but a lot of women tend to have more attempts. But a lot of times men tend to have, the men are usually the ones that have the more successful attempts compared to the women. Now, to answer your question regarding what is done to basically bridge the gap, well, as it pertains to, for example, men, I must say big shout out to Amy Gums, who has made quite some deliberate effort and strides in helping to promote and bring more awareness to men's mental health through his organization. So that has been one area in which, from a community perspective, more attention has been brought towards men. And more so, I must say, from my perspective, because I know that a lot of times it's more difficult to get men and keep them in therapy, we oftentimes make more of an effort to ensure that men attend their sessions. So whereas in a woman would say, okay, no problem, I'll type in my next appointment in the session, men would be like, yeah, just remind me. You know, so sometimes it just takes that effort, extra effort from the clinicians to ensure to keep the men in therapy. Thank you, Madam Chair, for the floor.
Thank you, Dr. Lambert. Were all the questions answered? Or, Dr. Thomas, are you? I think there was also other question in regards to the cannabis. Dr. Thomas, you have the floor.
Yes. Through you, Madam Chair, to MP La Vega. When it comes to the outlook on the legislation, we know that marijuana is here. So we know that the legislation, what we're saying as an institution is let's ensure that we have the right institutions in place, because legalization, of course, will mean more smokers. That is definitely, research has proven that. In terms of, we have right now currently where the schools, every week we're called to the schools, the students are under the influence. They are under the influence, they won't be able to function. So what we're saying as an organization is that, listen, the structure, in terms of rehabilitation, the institution, the right institutions, we don't have them. We even don't have the space, the capacity. We currently have a waiting list of 37. And those are, we see our clients are younger and younger all the time. So we're saying, let's ensure that we do what we have to do as a country before this legislation. But we know that marijuana is around. However, MP, marijuana being legalized, you will have more smokers. Thank you.
Thank you, Dr. Thomas. I now continue with the next member of Parliament, MP York. You have the floor.
Thank you, Madam Chair. Good afternoon to the guests in the Tribune. Good afternoon to those viewing this meeting, and a special good afternoon to our two esteemed guests, Dr. Thomas McCoo and Dr. Lambert. With that being said, Madam Chair, and given the time and nature of this meeting, I scrapped a lot of my questions, and I'll more focus on one thing, as it being addiction. Before doing that, Dr. Lambert alluded to the past, or one of the past VSA ministers, Minister Utley, now MP, that in those years, and actually since then, there's been an increase in mental health awareness, increased mental health awareness campaigns, etc., but also increased awareness in general. More people are speaking on the topic. My question would be for both doctors, does the increase in awareness match an increase in financial support? Because I know, as it pertains to Turning Point, years back, it used to be under VSR and it moved over to Justice, etc. But with increased awareness comes increased, like how what Dr. Lambert said, more requests for awareness campaigns, more requests for patients, more clients signing up. Does increase in awareness match with increase of financial support? Moving over to addiction, I would like if Dr. Thomas McCool would be able to elude more on addiction amongst our youth. When we think of addiction, we think of substance abuse, and often when we think of youth and substance abuse, we think of the high schools. Can Dr. McCool explain or elaborate more on the ages in which the youth are being confronted with substance abuse? I would say the other way around, the two institutions identifying the youths among substance abuse users amongst the youths. Next to that, substance abusers are often stigmatized by in the society. The question would be, is addiction a symptom of mental health struggles, or does it create them? I would like to know the two doctors' opinions on that. Furthermore, when I look also at the pending legislation, when I look from the side of government, when I look at increased alcohol promotions from the side of the private sector, what are the doctors' opinions on the following? Are we addressing the root causes of addiction, or are we just managing the consequences? Because on one end, we're looking for more support and financial support as it pertains to expansion of both institutions. And on the other end, more things are being added that would increase possible clients in the future. So are we addressing the root causes of the addiction, or just managing the consequences? And furthermore, to expand on that, is addiction an individual failure? Seeing the rise in addiction, even though there are more awareness campaigns and more promos and awareness on the topics, period. So is addiction an individual failure, or a symptom of a failing system? I would like to know the opinions of the two doctors on that. And also, lastly, Dr. Thomas McCool alluded to expansive waiting list for the Turning Point Institute. Is it freely available? So if I am substance abuse, or I feel I need help, can I just walk up to a Turning Point and be admitted? Because if you have such an extensive waiting list, I can only assume that people that need help now and need help ASAP cannot be helped. So as it pertains to that, what would also be needed? What kind of expansion is needed to be able to assist those looking at your extensive waiting list, etc.? And that would be it for my questions. Thank you.
Thank you, MP York. Before we go over to the answering of the questions, I just want to remind the members that we also created a unique opportunity to have the public also involved, and there are questions from the public, so I would love to come to the answering of those questions. You now may answer. Dr. Lambert, you have the floor.
Thank you, MP York. Through you, Madam Chair, I would like to respond to the questions posed. Very interesting question. Does the increase in awareness match the financial factors? Indeed, seeing that the stigma, thankfully, has been reducing over the years, I must admit that more and more persons are indeed seeking the help at the Mental Health Foundation. I do recall when I started to work at the Mental Health Foundation, I was the only adult psychologist working at the Mental Health Foundation alongside my counterpart, which was one child psychologist. And through the demands, that is where we were able to get a waiting list. This is something that we have been alarming as a V to indicate to them that with the demands that we have, we were unable to meet the growing demands of persons that wanted the help. So with that, indeed, finance played a role. We were able to increase the funds that we receive yearly, which we were then able to then hire more psychologists. That is how we're, at the moment, we now have 5 psychologists, so that indeed helps. An additional factor that plays a role financially is also having to expand the facility. The interesting thing is that we've had more psychologists, but in the same building. So what we've had to do actually is made the office spaces, some office spaces, we've had to just become creative. And a lot of, in many cases, 2 office spaces were developed through 1 office. And we continue to try to find ways to have more clinicians, and we try to make it work in the small building that we have. An additional factor is also, for example, we're now able to then offer more therapies because obviously if we get more persons, the problems that we're encountering are also more severe. So more funds indeed would then be allotted towards enhancing the clinicians, and I won't say only the clinicians, for example, in the clinic, but also various clinicians that work in the other departments as well too. Unfortunately, much of the budget is only allotted towards the clinic, so only persons in the clinic receive, for example, the opportunity to advance their education. But one thing that we would like to do, and we're working towards, is getting more funds to also educate the nurses and other persons within the Mental Health Foundation that are working directly with the clients, because in many cases, they also face very extreme cases, and it's not only the clinicians. So we all need to enhance in our education. And also seeing that there are many clients that are coming to mental health and need the services. One of the approaches that I for sure took was creating a more modernized approach. While back, for example, back in the days, we would have to manually score assessments, which take quite some time and quite some hours to hand score assessments. So one thing we have been working towards is also having more digital assessments. So for example, whereas it would take, for example, 4 to 5 hours to hand score an assessment, now we have the ability to put it in a program, and then the program is now able to help us digitally score the assessment. But obviously these things cost money. So that is based on my observation and experience, the correlation between the increase in clients and the financial matches. Thank you, Madam Chair.
Thank you, Dr. Lambert. Were all the questions answered, or is there also from the side yet? Everything was answered? Or Dr. Thomas, you were going to answer a question as well?
Yes, Madam Chair, through you, MP York, I cannot answer all your questions right now, but you need to send me them in writing, but I'm going to answer those that I have here. Does the increase in awareness match the increase in subsidy? I think that was the question. Yeah, financials. I will say no. I will say no. Did addiction amongst youth increase? I will say yes, and we have those data. Prior to when I started at Turning Point in 2020, I remember we had students that were coming and doing drug education. We had 13 students. Today we are at 83 students. So there is an increase since then. All right? And of course, I must say as well, that increase is not only marijuana. You have a mixture. You have pills, you have marijuana, you have, last year we tested students who tested positive for cocaine, and that was at a high school. You also had a question about when it comes to prevention, if it's only high school. No, we started prevention now at elementary because we realized that students also suffer from addiction in those schools, not only, and I wouldn't say marijuana, but inhalation and vaping. Yeah, so that as well changed in the last couple of years. We found ourselves going into elementary schools even more now. Does addiction cause mental illnesses, or does mental illnesses cause addiction? And that's a very good question, because addiction causes mental illnesses. Yeah, so over a long period, and it depends, but also mental ill clients starts to use substance as well. So we see that with our schizophrenic clients. So we have those who are schizophrenic, but it's induced via marijuana. But we also have where some of our clients who are schizophrenics, well, from the Mental Health Foundation, they begin to use substance to try to cope. I mean, it's not the right coping mechanism, but we see that as well. Is addiction an individual failure or the failure of a system? That was the question. Through you, Madam Chair, can I ask the Member of Parliament to just repeat that question? Because I'm trying to understand, was that the question?
MP York, you can repeat that question.
Repeat that question and not the question I think that was missed. The question was, is addiction an individual failure of symptom of a failing system? The other question was, are we addressing the root causes of addiction or just managing the consequences? And I'll take the liberty to add one more question to that. What do the two doctors advise schools to do once they identify a student coming to school under the influence?
If Dr. Thomas, if you can answer those remaining 3 questions from MP York.
Okay, so I will answer the last one. The others I will send you by writing because I will have to elaborate there, MP. But what do we do as an institution? So first of all, the schools send the students by us for testing. So once the student is tested positive, of course, we send back the seal envelope to the school, and the student then follow drug education. And at times, the reason why those students are using substance is because of social issues. So then we have family meeting with the parents. So that is the way that Turning Point deals with it. And in any cases, if we have to continue seeing the student, then we do. Yeah, so I hope that answers your question.
Thank you, MP. Thank you, Dr. Thomas and MP York. As mentioned, the other questions will be sent in writing if that's okay with you. Seems to be okay. I now give the floor to MP Lacruz. MP Lacruz, you have the floor.
A blessed morning, and thank you, Madam Chair Lady Rifir, those in the Tribune, my fellow colleagues, and the doctors in the House. A blessed, blessed morning to all those watching and listening. Madam Chair Lady, as I sat and listened to the presentations, I missed a couple things, and I'm going to elaborate a little on them because of my personal experience and experience with my kids in school, on a lot of the matters that were discussed today. I'd like to start with this one, if both could give a detail. This is what you do, this is what you do, this is what you do when you come in contact or have realized that a family member of yours has mental issues. And when I say, and I know it's broad because it's a lot of things you would have to look at that the normal eye would not see. But give us the top 5, okay? And I'm saying this because going back to the statement that Mr. DeWitt made concerning the child last year that committed suicide, it came to my attention that a family member went to court of guardianship months before this took place and asked for them to intervene. I do not know if any one of the doctors came in contact or knew of this case before, but even worse, after that after it took place, no one reached out either. And a second child in the home attempted to take her own life also. Now, this is not something that I would want to bring on the floor of Parliament because it is, people's personal business. But it is important to me that people understand where and what is happening and where we're going wrong. Where are we going wrong? Why have we now, in the last 2 years, 3 years, have more cases of our kids committing suicide than 10 years ago? Is that a fact or is it not a fact? Do we have the numbers? I remember being a child, and my father would make a statement, for example, don't act like a little girl. If you had an issue, deal with it as a man. Which brings me to my second point. I've not seen a campaign, and maybe there was, I missed it, on educating our Caribbean men that it is okay to ask for help. Caribbean men are taught and were raised to be the strong one in the house. And if you ask for help, again, you're acting like a little girl, or you can't handle it. So a campaign of that matter, right, dealing with that, I think, would solve a lot in the beginning, because you are now grabbing, and as we say, the head of the house, to say it is okay to say that you need help, where then the kids would be able to not have a problem asking for help at an earlier stage. And it comes to, again, this is not a scientific fact, because I am not a doctor, but from my personal experience, and also living in or being raised by a father figure that was highly addicted to drugs. And when I say, I'm talking about drugs, alcohol, everything you could think about, cocaine, crack. Being raised as a child in a household like that, the effects are, and I would say, traumatizing, because I have chosen to never drink a beer in my life, never smoke a cigarette, never smoke any marijuana, never do any drugs, because of what I went through. But in my case, I turned it around. I made sure that it didn't affect me in that manner. So those are the things that I'm missing to be able to say, hey, okay, our kids, this is what we could do with you. This is where we're going, a plan in that manner. I've also seen, living in Aruba, for example, in a village, I lived in the years in a village where there were 30, 40, what we call cholas, crackheads, okay? And they would go into the institute in Dakota, and you would just see them disappear for a year or two. And when they come out, what you saw was a total different individual, clean, but not only clean for a moment, but clean that they would not end back up on drugs, okay? What is your experience with the people that you have helped? Where are they today? Let's say in the last 3 years. What are you missing to be able to have that effect? Because when I drive on the road, what I am seeing, and I'm not attacking the institutes, what I need, I'm going to ask you at the end, what I see on the streets is every day more and more, I am seeing more of our people looking like crackheads or with mental issues, sitting by bus stops, bathing themselves with dirt, or just losing it. So as legislators, what I think what I would like is a concrete plan of what you would need from us. What you would need from us. If you need funding, you say, this is how much we need. if you have a plan on how you could encourage or entice new psychologists, psychiatrists, doctors, nurses to your institutes, we need to hear that, because that is the only thing we could do. We could amend the budget, we could come up with ideas, and Dr. Thomas Maku, your turning point falls under the Minister of Justice, and Dr. Tamika Lambert, mental health falls under the Dr. VSR, the Minister of VSR. Let them both know that MP La Cruz has a lot of ideas to increase the funding for your institutes, to please, as he has been begging for the last months, to sit down with them and make it happen, move in the direction to get it done.
MP La Cruz, this is
Then
questions for the specialists. So
this is for the, I'm telling the,
yeah,
the specialists.
So not politically.
No, it's not political. I'm asking them, I'm telling them exactly, Madam Chair, how they could get the help that they need. Thank you. And I do understand that it's the Minister of VSR is URSM, so I understand your statement, but it's not political. Thank you.
As
Then-
mentioned, panelists, this panel is focused on how the matters can be tackled. So those questions should be focused on that topic. So I'm asking you to answer those questions. Are you done,
Could I
MP La
continue?
Cruz? I also want to remind you, MP La Cruz, seeing that I want to give the other members that weren't able to speak as yet also the opportunity to speak. And as I mentioned as well, we have people out of the community which engaged in this discussion, and I would like to give them the opportunity as well, seeing the unique opportunity that was created for them to also get answers to their questions. So I would like to ask you to finalize, because the idea, as I mentioned as well, members, first it was one question, but I said that's a little bit too little, but it is not the idea to ask a lot of questions so that we cannot have the interactive debate. And that is defeating the purpose, actually. So I would like to ask you if you have one or two more questions to ask those, so that I can give the other members, remaining members, also the opportunity to ask their question. Yes, MP La Cruz? You have the floor.
Thank you for the interruption, Madam Chair Lady. So like I said, my last statement was basically, what can we do to help you? That is, because otherwise we are just at it again and again and again, and every year we'll be right back here, like MP Westcott said. Okay? Thank you, doctors.
Thank you, MP La Cruz. To the panelists, if you can answer the questions of MP La Cruz, the questions that you cannot answer, you can also send them via email. So for what you can answer, please answer. Dr. Lambert, you have the floor.
All right, Madam Chair, through you, I would like to, first of all, applaud you, Ms. MP La Cruz, for being transparent and sharing your personal experiences within the field of mental health. As it pertains to the steps, so I'll first address the steps in how persons can receive the necessary care. Then I will address the increase of what has caused various persons to need mental health services. And then fourthly, I'll address your question regarding what are the steps that can be done to receive the necessary support from the government. All right, so if someone is experiencing a mental health challenge, the steps to receive support is quite simple. First of all, if it's a crisis, persons can contact our crisis line, which is 24 hours. So it doesn't per se mean that if you're experiencing a mental health challenge, it can also be someone within your community or someone within your family. So the number is 585-35 and a 6. 585-35 and a 6. And a 6. And once anybody calls this number, we have 4 of our crisis nurses who answer this call at any time of the day. All right. Now, if someone is experiencing a mental health challenge, which can be a family member or even yourself, The first step is basically to go to your general practitioner. Your general practitioner will then assign you as a client to the necessary party, whether you would, for example, go to the Mental Health Foundation, or whether they would recommend that you go, for example, to a private practice. So those are the two simple steps. If it's a crisis, call the crisis line. If it's something that can wait in a sense, then you then contact your GP, and then once you go to your GP, you receive a referral letter, and then you will then come to the Mental Health Foundation, and then we have a multidisciplinary team that will assign the case accordingly based on level of urgency. Now, I will now answer your next question: what has caused the increase in mental illnesses on our island, especially regarding suicides? Please note that ever since Hurricane Irma and the COVID-19, that has for sure increased a lot of the cases. As it pertains to suicide, what I would like to do is I would like to turn the floor over to one of our professionals that work at the clinic, which is Ms. Giselle Codrington, who predominantly works with the youth that are experiencing suicidal thoughts.
Thank you, Ms. Codrington. You have the floor.
Thank you. So I am one of the youth psychologists by Mental Health Foundation. I am also the person who witness every day the silent struggle of our youths. I have spoken with children, teenagers who felt lost, who felt overwhelmed or trapped in their pain, some resorting to self-harm or even attempting to take their own life. Understanding crisis is very important. The stigma is there for sure, and we mentioned a few times that person feels weak. When it comes to children, I often hear they are seeking attention. Lack to mental health services. We give mental health services, however, not all parents have insurance, so they pay out of pocket, and we believe that's one of the reasons why parents does not seek help when they notice signs with their children. One of the main things is exposure to trauma, violence, and unstable house. These are the factors we don't have control over. Many children and teens grow up in difficult environments, split homes. They experience neglect, abuse, or violence. These traumatic experiences cause deep emotional wounds, so they're dealing with anxiety, they're dealing with depression. This caused the increase in suicidal attempts that we see. In addition, the youths are not active, so they mostly go to school and they go home. What we need is free community programs. A lot of times I struggle in session trying to figure out what can you do to socialize, to make friends. You have to pay for swimming, you have to pay for sports, you have to pay for everything. And it don't have to be that technical. It could be walking groups in the community. It could be somebody in the community just leading out in an activity, but our youths needs to be active, and that's something that would help with the numbers.
Thank you, Ms. Codrington. I now go over to Dr. Lambert. You have the floor.
To my esteemed colleague, I would just like to provide some additional suggestions.
Yes.
Yes, I would like to provide some additional ways of support in which the government can support us. Is first of all, simply providing continued support. I know when I came, the question was, is this your first time here? And I was like, yes, it's my first time here in the Parliament building. I think these platforms are actually very important because you have a lot of persons that are tuned in, that are listening to what are the real concerns within our community. So I think this is a great opportunity. This is a first great step. Also, what would be very helpful is having more persons within the community that are willing to provide care and support to persons in need. A lot of times when requests come in, a lot of times I have to kind of deny it, is because the demands of the mental health are so extreme that we can only do what we can within our limited scope. And I oftentimes say, like, you don't per se have to be a professional to be able to provide support to someone. Sometimes you have persons with a problem that may be on a lighter scale, and they can receive the support from someone that is trained. So for example, I always provide trainings to persons within the clinic and within the mental health for them to also be able to provide support. So it'd be great if we have persons in the community that are open to provide the care, and that way we can expand the support to persons in the community. And also by having more campaigns. For example, as I indicated, you have, for example, Mr. Ami Gums. He has his men's mental health campaign. I think it would be great if we support those endeavors, because he helps us out a lot as an organization. It would be great that you have other persons that stand up and do various campaigns, because I oftentimes say that mental health is not only the Mental Health Foundation. Mental health can be various persons within the community, because the more hands we have involved, the more persons we can reach. And finally, I would say by basically advancing the policies that we have, I must say, big shout out once again under the leadership of Minister Otley. When he was over Minister of VSA, we were able to enhance the policy, whereas in the past, persons were only able to receive care once they were a threat to themselves or other persons. But thankfully, thanks to the support under that leadership, the doctor at the Mental Health Foundation, we were able to develop new articles that, for example, persons that you see on the street are now able to receive the care by a family member, and those persons are also able to receive the care if the Mental Health Foundation deems it fit. So that in itself was a great development, and that is where I think that is a development that we can continue to build on more policies to be able to help more persons that are in need of mental health care services. Thank you so much for the floor, Madam Chair, and thank you once again for your questions.
Thank you, Dr. Lambert. Dr. Thomas, you want to add as well?
Yes, through you, Madam Chair. MP Lacroix, thank you for your questions. What do you do when you recognize that a client need help in terms of a mental illness or suicide? With us at Turning Point, we contact the Mental Health Foundation, because most of our schizophrenic clients, for instance, once they are admitted, sometimes they're suicidal ideation, or even so we contact the Mental Health Foundation. They come, and so sometimes they come, they give them SOS. Sometimes they go back to the Mental Health Foundation because they're isolated there. Turning Point does not have any isolation room, so we don't keep those clients. We refer them to the Mental Health Foundation. I first have to say as well, thank you to Marcel, because whenever I call him, he comes to my rescue. But those are some of the things that we do. Or once a client is no longer at Turning Point and they're already home, then we go to the house and we assist them there. So we try to contact mental health, or we take them to mental health. Why most students are committing suicide now, and that is a question that, this is not only in St. Martin, this is all over the world, but I think it has a lot to do with social issues, social media, substance at time. And we first have to understand that the world has changed. Parents work more jobs right now to make ends meet. So most of the time, those children are alone. Yeah, so that is something that we are seeing a lot of. Is there any campaign done to raise awareness? Well, Turning Point is part of the GCO, and one of the things that we do, we with the KPSM, the prosecutor, we go into the school, we speak about crime, we speak about substance, we speak about, I think, mental health as well is part of that committee. So those, we bring awareness there. Of course, we want to do more at Turning Point, but it's just 2 psychologists, 1 psychiatrist that we share with the hospital. So of course, in terms of capacity, that's a problem as well. But we do what we can. What is your experience? No, where's the people that you helped prior, where are they? I'm proud to stand here, my team is here, and say that the people that we help, I'm at Turning Point since 2020, and then since then we've had just 3 fallback. Of course, we wish to have none. But studies has also proven that sometimes it takes more than once to be, So I will say they are working, and I want to big up as well those institutions, the hotels, most of them are hotels. They give them jobs, so they understand that, hey, these persons need second chance, and of course, they could go back into the community and live lives again. And of course, when it comes on creating a plan for Parliament to help us, you will get that plan. Thank you.
Thank you, Dr. Thomas. I now go over to MP Otley. MP Otley, you have the floor.
Thank you, Madam Chair. Good day to my esteemed colleagues, the viewing and listening public, those in the Tribune, and both doctors here today. I thank you very much for your time you have taken to come and not only explain us members of Parliament, but also the public of St. Martin. I believe these discussions are very fruitful. You have an audience that probably you won't typically have at this moment. And with this discussion, we have an audience that we probably won't typically have. I first off would like to thank Dr. Lambert for publicly acknowledging the work. As a member of Parliament and even a political figure, a lot of things that we do go overlooked. So to hear a public appreciation, I cannot let it go unsaid. I publicly thank you for that. A lot of things people do not understand when it pertains to MHF is exactly what you stated. I had it here in my notes, the involuntary admittance. Persons are admitted on a voluntary basis. So when we see persons in the street, a lot of people in the public does not understand and say, why do we have this person in the street? Why don't we pick them up? But we cannot, and I say we, so we're in it together. You cannot pick them up unless they're a danger to themselves and others. So the police cannot just go and take you. When you become a danger to yourself and others, then you have, whether it's a cassette or something would be signed, and then the person would be forcefully admitted. And in a lot of awareness campaigning and also dialogue with our partners in Aruba and Curacao, we also realized that there were a lot of legislation that were there from 1920s that has never been used. And one of them was the same policy in which you speak of, which allows the family members or allow a community-based approach to involuntarily admit this person before it becomes too grand. But with that being said, the problem that MHF faces is capacity. Capacity. When you go for yourself and you see the facility, you understand what you have to go through. And we all want more, but in order to get more, we need to spend more. So with that, I am grateful that, with the assistance of the World Bank, we were able to secure funding. I am also grateful that you stated even my it would be successor, MP Veronica Janssen, she was able to secure some more funds in order to get us moving. And I saw in the 2024 budget amendment, there were funds there for mental health, in which I know then Minister Janssen allowed this amendment. So I'm happy to see continuity. But I want the public and yourself to also know that mental health is on our radar. We requested a meeting since March